Ciao mondo, hello world, hola mundo, hello mon, konnichiwa, ni hao, namaste. So the entire world is waiting the product of this last ADQI on digital health. And we're here this morning to present the most recent advances in what has been the work of Group 5 dealing with barriers and
challenges. So we have 3 questions here, and I'm gonna explain what are the questions that we have been working on for like 3 days. And we have also some awesome figures that I don't know if we can show to you because you can just see us in the picture, but I'm gonna just read the question. So we had the first question as, what are the barriers that might inhibit the identification of some of the healthcare needs and also the appropriate choice of digital healthcare tools to improve prevention, detection, or treatment of AKI? So that was the first question. We had another question. What are the barriers to implementing those tools once you have the idea into the clinical practice? And then, of course, the ethical, legal, social issues. Those are very important. Don't forget about them. So that was our third question.
fantastic, but then if you had to prioritize your top 3 barriers to the application of digital health to the area of acute kidney injury, what would be your answer?
I would say the first one that comes to my mind, and of course my answers might be different from other people, is that the first one is lack of resources. Because if you think about that globally, there might be many areas that might not have the right resources. So that's the first one. The second one is training. We need training also for training the next generation, training the staff that are going to use the digital tools, as well as some of the literacy issues that we have, digital literacy issues. And the third one is that we are just starting to look into some of the legal and social issues. So that's a recent research area for many people.
One last comment on ethical issues.
Try to learn about them. It's okay if you don't know anything about them or if you're just starting to learn, but it's important to learn about them.
So, thank you for joining today Cappuccino from San Diego. We're going to begin the CRT and AKI meeting in 1 day, but the product of this ADQI meeting will be hopefully published very soon, and we will have the chance to improve our application of digital health to AKI and to our clinical life. Thank you very much and have a wonderful day. Excellent.
Excellent.